Hi there. My name is Stan Holt. I'm the senior advisor at Partners for Impact. We're a small consulting firm in Apex, really close to Raleigh. And we spend a lot of time working to build the capacity of organizations, communities, as they endeavor to create community change, kind of community change initiatives. And so we find ourselves working with individuals, organizations, and whole systems in building capacity to create that community change. And today I'm here with my colleague Charlene, who I'll have you introduce yourself now. Charlene.
Hi everyone, I'm Charlene Reiss. I am a consultant working out of Durham, close to Raleigh as well. And I've worked in the nonprofit public sector for 30 some years, and have been working with Stan and Partners for Impact for the last year and a half or so.
And Charlene, it was funny because as I was thinking about this, I was thinking about how we met in graduate school. And then, do you remember what our first evaluation project together was?
The HPRP program?
Yeah, Homeless Prevention Rapid Rehousing Program.
Right.
We got to design the plan, the evaluation plan for the state. Unfortunately, they didn't have any money to implement the evaluation.
Right. But it was a good exercise and got you some dissertation data.
It did.
Yeah, good. And it was a fun project to work on.
So, yeah, it really was. So the thing that we want to kind of do today is talk about kind of our lessons in a project that we have been working on called the Kaleidoscope Project that really helped us begin to think about equity and its role in program design and implementation and evaluation. Charlene, do you want to say anything else about the Kaleidoscope Project?
I'll just say the Kaleidoscope Project is a project funded by the John Rex Endowment that was designing places and spaces to improve children's mental health and well-being. And we were brought in the last year of the first phase of the project to do the evaluation, and that's really what we were focused on. But as Stan was saying, as we were doing the evaluation, we really learned a lot about equity as we saw it happen, trying to tease out what was happening in the project. And have spent a lot of time since then thinking about how that plays back into program design. So it's that whole model of evaluation and program design, and then putting an equity lens on it.
Right, and one of the tools that you and I both use a lot is a logic model. And that's something that we've got some other little tutorials on our website or our YouTube page that goes into the logic models. But I'll just remind you that the logic model is a graphic way to depict both your program and the evaluation of your program. And it's got the kind of inputs or the resources that you need for your program. It's got activities or the things that you do and the outputs associated with that. And then it's got the outcomes, or what I call the change that you want to see in the community. And it was that, it seems like I am supposed to stop there. And are you supposed to say something now? No. I'm yeah.
Yeah. I'm trying to remember what so yes, we have this graphic display.
Yeah.
It's inputs, activities, outcomes, outputs, outcomes, and then impact. And I kind of think of impact as your vision, kind of that vision statement. What's your pie in the sky of how this project is going to really affect the larger community change. What's not in a box on the logic model is evaluation. There's not a box for evaluation in this type of logic model because it should be built into the whole process. There are plenty of evaluations that are done after the fact, right? 3 years in, you do the evaluation, you look back on what were the inputs, what happened, was change affected, but that doesn't give you any opportunity to improve your program while you're doing it. So a program design and evaluation, you'll be thinking about how you are monitoring what you're doing and evaluating it as you go, so that you are providing input right back into the system. You're providing feedback into the system so that you can make improvements. You can make sure that you are doing what you thought you were doing. You are doing what you intend to do. If you are not achieving the results that you want to achieve, you're making adjustments so that you can do it, can do what you want to do. So that the evaluation process is built in, and it's an ongoing feedback loop.
Right, and there's certainly specific evaluation lingo that we hope maybe we'll talk about in the future, about developmental evaluations and formative evaluations that occur kind of on the front end of the implementation of your project. But I want to go to the outcomes piece, because this question is what led us to the equity conversation, right? And that was, when we think of outcomes, or when I think of outcomes, I really always go with what changed for what group of people, right? You have a target audience and you want to create an intervention that results in change. We have a target audience of young people. We want to do some sort of mentorship program, and we want to see that the youth improve their social skills or employment skills or whatever it might be, right? And so at some point it clicked for me when I said, wait a minute, right? There are almost always some sort of automatic differences in the target population based on who those populations are at the very get-go. And we know that's true, for example, for people who live in a particular zip code, or people who have a particular skin color, right? We know that things are different because of inequities that exist in the system. And that's what really started me thinking about, how do we bring equity to this whole process?
Right. We really, as we were working through the evaluation for this project together, this Kaleidoscope project, we really started asking those questions of who is being impacted by the project, and how are different groups experiencing different impact based on who they are. And that's kind of the fundamentals of equitable evaluation, or really looking at issues of equity, is recognizing that everybody does not have a singular experience. There's not one experience that you can say that everybody across the board has. And looking at the way that our society is built, and the way that the inequities in the system play out, there are systems that essentially advantage white people over people of color. And so if we're looking at programs that are running, that we're evaluating, if we just look at a broad brush, or we look at an average over everybody, it's not really going to tell us how things changed for each group. It'll give us sort of the middling, but that it may be that for white kids with more advantage, the program does very well, and that for children of color, they don't do as well. But if we don't pull them out separately, if we don't pull out that data separately, we're not looking at it separately, we're not going to know what the differences are. And so it really makes you, once you kind of get that in your head, it really makes you think about designing the evaluation differently. Then once you start going down that road, you start thinking about designing the whole program with that in mind. How are you designing the program?
Yeah, and it reminds me just kind of the basic definition of equity, which is that whole notion of a fairness with regard to access to opportunity and outcome, right? And what we know is that there is inequity because we don't always start from the same place. When we're trying to put an intervention into play, our experience prior to that makes a huge difference in whether or not that intervention is going to make a difference.
Right. And we talk about racial equity and the differences by race. And there are other inequities in the system. And those inequities are often exacerbated or intersect with race. So, for example, working on a project designed for vulnerable children, and a lot of our discussion has been about what is the definition of vulnerable when you're talking about children. And so for some programs, vulnerable children are children with disabilities. And there's no argument that children with disabilities are vulnerable. What the racial equity lens brings in to that is that children of color who have disabilities have the intersectionality of their race and systemic racism, and that makes them vulnerable, and living with a disability that makes them vulnerable. And so they are they're going to be impacted more by the structural inequities than white children with disabilities, with no argument that white children with disabilities are vulnerable. It's just kind of putting this racial equity lens and recognizing the inherent compounding of inequities that can happen.
Right, and I hear some of our colleagues who do equity work really saying, remember that so much of our culture here, particularly in the States, has been built on the racial inequity that we talk about. And that's why really looking at those issues, the issues of racial inequity, are crucial and as part of the picture. Charlene, I'm kind of wondering if we have anything else to talk about on this introduction, or if we feel like we're kind of done.
Yeah, I think that I think this is a good intro. We hope to have more videos walking through what an equitable evaluation would look like, what we learned as we were doing it, and what we're really focusing on as we move forward and build a new program with evaluation in mind and with racial equity in mind. So some more concrete tools around that. If you like our videos, please like them and subscribe to our channel.
Yeah, and you can also find other resources at the channel and on our website at partnersforimpact.com. And with that, I'm going to say thank you, Charlene.
Thank you, Stan.
And thanks for everybody for taking the time to just listen to this introduction.